Hi, this is Purnima Devi, Assistant Professor in the Department of Computer Science and Engineering in SNS College of Technology, and these are all my mentees. So now we discuss about COVID-19 pandemic situation related with design thinking. So for in our institution, we used design thinking for problem identification and how to solve the problems using the design thinking method. So we follow the 5 stages to how to identify the problem and how to solve it and how to maintain the solution and how to increase our possibilities using this design thinking process. So we discussed related with this COVID design thinking, how to relate with the COVID-19 pandemic situation.
Okay, now I'm going to explain you the empathize. As we all know, empathy is about how we understand the user's pinpoints and how they are suffering and how they get struggles. To talk about COVID-19, as we all know, it has become a very big cause in today's scenario. To tell about COVID-19 is, first we should know the precautions which we are using. Like before this, based on the symptoms, we have to identify what are the remedies should be done, and to talk about quick decision making. If the causes occurs, we should think about what are the next steps we are going to take. So based on this, I think little precaution may be better for this solution.
So let's look at the define phase. In define phase, we will be defining the problem statement, and here the problem statement is defined as healthcare systems struggled with predicting the patients who were at risk in COVID-19 infection. There was a need for an easy to understand tool that could analyze the patient data and identify if the patient is suffering from the is infected from the COVID-19 or not. So that they can predict the recovery and critical condition outcomes.
Okay, I'm going to talk about the ideal phase. So coming on to the COVID-19, so we have to analyze the data by using some tests. So here we are using visualization tools like Tableau and Power BI for to get the accurate data about the patients. So it will be useful and easy to analyze the reports and how much of people are affected by the COVID and how much of people are not affected. But the symptoms are sometimes will be similar. So some people have fever, cold and cough, but they are not affected by the COVID-19. And some people will be affected and they also have the COVID-19 issues. So to analyze the data accurately and to get the accurate data and information, it will be as well as useful to the hospital management and also to the doctors. So my point of view, they can use the tools like Tableau and also the Power BI to analyze the data in the graphical representation, like using the pie chart, bar chart and the histogram. So we can analyze the data and the percentages.
Ideation part, suppose is the story part. So here what we can do data visualization is we can first collect the data sets. So you can collect the COVID-19 data sets, like the data sets should be how they have fever or their age concerns and their fever rate and their travel history. Everything will come under the data sets. So first we should collect the data sets and we should train the model. So before training, we should pre-process the data. In data visualization, we should pre-process the data. After that, we should train the model. We should train the model with the data sets we have already collected from the patients. So next, we should visualize the decision points. So how we should take the decision? As she said, we should separate the COVID, if they have COVID or not, we should separate it and we should visualize the decision points. So we should see the accuracy level. We should measure the accuracy from the visualized decision parts. So we should take the measured accuracy and we should build a prototype. This is how the process will be. So this is
Now I would like to conclude this session. As Kanmani said, we'll be using various tools like Power BI. I think in earlier we have studied like accuracy data will be like true positive, false negative, true negative. Such ways COVID-19 will be like the same. We can use various metrics to get an accurate value. The main problem faced during that is lack of bed, and doctor couldn't find what problem exactly they have. As you said, they couldn't find like whether it is COVID or not, or either simple fever or like a normal fever. But as DD process says, Jenny said, because we have to collect the data and doing pre-processing, and we have to process using various algorithms, we can find a right solution. I hope so. It will be very helpful to find a great solution for that.
Thank you. Thank you.